What do we know about the different variants? What is their presence here in the U.S.? And what are additional precautions that scientific advisors in the medical community are telling us to do with what we know?
The UK is exactly foreshadowing of what could happen in the United States and other places. Not only that, what we're learning about the UK variant is it's the one that we're the least concerned about. So not only is that a warning, It's like a mild warning of how bad things could be. So it's a great point. The UK variant, we are now starting to see it in pretty substantial numbers in the United States. It does look like the vaccine is effective against that variant. It transmits much more efficiently, and there is some suggestion that it might have a higher mortality rate. When we look at the other variants that are being closely studied at this point, one out of South Africa and one out of Brazil, we don't have the South African one in the U.S. yet. We did get the report of the first Brazilian variant in the U.S., but from somebody who had traveled to Brazil. So we don't know exactly how widespread those are. And indeed, our testing system is not great, as we all know. So we don't know how much any of these variants are in the United States. The bottom line with that, though, is it doesn't matter. They're coming. So whether there's a lot here now or there's going to be a lot here later, it's something that we have to worry about. The concern is primarily with the increased frequency of the spread of these variants. That means that, it's a race. It's a race between the virus, which is mutating, trying to get around these hurdles that we're putting up in front of it, the vaccines, previous infections, that type of a thing. This virus just wants to spread. And the increased mortality could be coupled with the increasing number of cases that we're seeing, and it could be devastating if we don't get everyone vaccinated ahead of time. The good news there is it does look like the vaccines are effective against all of these strains still.
Yeah, it's just a question of getting the vaccine to everyone soon enough.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.